Let's take a look at this case study here on a stroke patient. This is a Filipino patient, about 50 kilos, presents with some headache and altered mental status. We're looking at the language barrier being an issue with the history. Um, Basically, we are trying to use our LAPS positive, where we're looking at symptoms less than 24 hours, greater than 45 years old, no history of seizures, blood sugars between 60 and 400. And then we have some facial arm drift and some grip strength that we use to identify our LAPS positive. As we see in that slide, that the blood pressure wasn't extremely high, heart rate wasn't bradycardic, no Cushing's triad that was presenting with this case. The lapse didn't seem to be extremely positive. We do see that the state demographics show that we have, based on ethnicity and age, that the average age of somebody having a stroke is around 39 years old for Hawaii, and the Big Island, 42.7. As we look at the genetics and gender, as well as the ethnicity, we look at the Filipino culture being the highest, whereas the white being the lowest, and then the Hawaiian just behind that. Anyhow, we look at these large visceral occlusions, which can't be used or can't be treated with the use of thrombolytics. It's going to require some interventional radiology. And you see the Cincinnati pre-hospital stroke severity scale. We have a race and a fast ED. And it's looking at these large blood vessels that we can't use the thrombolytics. And mostly it's, there's some kind of gaze or eye deviation, plus or minus some altered mental status, and then the arm drift. We can kind of merge these all together. There is an eye drift deviation in pretty much all of them. There is the deployment of using the fast facial droop, arm symmetry, speech slurred, and then some extremity issues. I'd like to go ahead and thank everyone for participating and contributing information to our learning and knowledge base.